OASIS E1. Stay tuned for more information on the OASIS E1 changes that are coming in 2025. The draft OASIS E1 was released in January of 2024, and the guidance manual was released on May 3rd of 2024. We do expect final documents, of course, by the end of 2024 to be implemented in 2025. Some of the changes that have taken place with OASIS E are the result of the 6 factors that have been put in place to ensure that OASIS items meet the criteria in order to continue to be included in the OASIS dataset. The 6 criteria that are utilized to determine the use of an OASIS item include that item being utilized in the calculation of the Home Health Quality Reporting Program measures. Number 2, it could be utilized in the calculation of the Home Health Value-Based Purchasing Model. Number 3, it could be utilized in the calculation of PDGM reimbursement. Number 4, it could be utilized in the calculation of risk adjustment. Number 5, it could be utilized in the survey protocols for Medicare certification. And lastly, number 6, it could be utilized in the data category for the conditions of participation. If the item does not meet the factors included in one of those 6 reasons for utilizing the data, it will not continue to be included in OASIS. Because of this, the items MO110 and M2200 will be removed from the OASIS dataset effective January 1st of 2025. These 2 items have not been utilized in any of those capacities since January of 2020 for the Medicare program. These items may have continued to be utilized in other private insurance plans, etc., but they have been discontinued for use in Medicare and will be removed from the OASIS. They will also be removing the discharge status column for the items GG130 and GG170. While the GG items will of course remain on the OASIS dataset, the discharge columns are not being utilized effectively. You are allowed to mark only one discharge status in that entire section, and as a result, cannot be effectively utilized in measure calculation, and therefore the column will be removed. The removal of the discharge column also lines up the OASIS with the Home Health Value-Based Purchasing Model changes that will begin in 2025, where the GG130 section specifically questions A, B, and C. In addition, GG170 items A, C, D, E, F, I, R, and J will be utilized in the new discharge function score that will be reported in the value-based purchasing model. In the calculation of the discharge function score, they will be utilizing your responses on the start of care and resumption of care, putting those into an algorithm CMS has developed, and calculating an expected discharge status of the patient. Once you report your discharge status within a discharge OASIS, they will be looking at the patient's functional status from these GG items at discharge and comparing it to the results of the algorithm. If you have results as good or better than the algorithm results, then you will have a positive outcome calculation. In addition to these changes with the deletion of items, they will be adding one brand new item in the O section of the OASIS that is specific to the patient's COVID-19 vaccination and whether or not it is up to date. This item will only be responded to at transfer, death at home, and discharge. It will not be included on the start of care, resumption of care, or follow-up OASIS. On this item specifically, the clinician will simply be answering yes, the patient is up to date with COVID vaccinations, or no, they are not. The draft guidance manual for OASIS E1 that was released in May gave specific direction regarding the completion of this COVID-19 vaccination item, in stating that agencies will be required to not only obtain the information from the patient, but they will also be allowed to interview caregivers, look at the patient's medical record, and you will also be able to gather status from the CDC website, where you are already looking for contraindications for the influenza vaccination. The OASIS E1 guidance manual is still in draft form, and we expect to be finalized by the end of 2024. Also keep in mind that in July of 2024, we will see a proposed rule for 2025, which could lead to additional changes to OASIS E1 before they actually issue a final document. Agencies should be training now on OASIS E1 and enhancing your education with the GG items that are currently on the OASIS E. These GG items that will impact the value-based purchasing model have consequences with the outcome measures to impact reimbursement significantly in the value-based purchasing model calculation. The items that will be utilized for these measures, as stated earlier, the start of care and resumptions of care that you complete in the third and fourth quarters of 2024 could lead to a discharge in 2025, where that discharge will be utilized to calculate the outcome. So it is imperative that education happen immediately. Healthcare Provider Solutions is happy to assist with all your education needs, including very specific OASIS E and the guidance for completing the OASIS E document and the new OASIS E1.